weapons at this time.
I finally
All right,
found them all.
Guys, I want to welcome you here this afternoon. I'm the first one to apologize. After 30 years of being the judge, the one thing they'll say about me is I'm anal retentive about starting on time. And I'm sure there's somebody here that could diagnose me with some type of issue, but I tend to show up on time. But unfortunately, or fortunately, this is the third meeting I've chaired today. So luckily the other one was just across the street. But I thought, let's give Shauna some heart palpitations here today for walking in at 1 o'clock. But I do want to welcome you to our September meeting of the Kentucky Judicial Commission on Mental Health. Today's meeting, honestly, is an extra special day because as you can see with the cake we are celebrating the commission's third-year anniversary. Chief Justice, I cannot imagine, it does not seem like it's been 3 years that we've been sitting here, but it is a momentous occasion, or at least I think it's a momentous occasion for us to celebrate. We've had 3 years of learning, growing, and building together. Before we dive in, I'd like to pause for just a moment to reflect on a few. When I say a few, I started going over this list. I said, it's not a few, it's quite a bit of accomplishments, or at least I feel it's quite a bit of accomplishments that have been reached in the last 3 years. And I want to touch on those very briefly with you if I could. We've had 3 statewide mapping initiatives completed. And the thing that's amazing, we've done one for each system: criminal justice, juvenile justice, and child welfare. And I'm sometimes not totally sure that our committee fully understands what a major accomplishment that is. And it really is. And the credit goes out to each and every one of you that are taking part in that. We've had the largest behavioral health training event in Kentucky's history. I can remember as we planned for that going into it, as we started off going, oh, can we just get 100 or a couple hundred or whatever? And I think our summit, we had a little over 1,100 participants from across the state, and it was absolutely an amazing, amazing turnout. We've had town hall meetings that ensured we heard directly from Kentuckians about their lived experiences with the courts and the behavioral health system. One of the things I've learned over the years as a judge, and I know Chief Justice will agree with me, we often have a perception of how well we're doing and how hard we're trying to accomplish things. But then when we talk to the people we're actually working for, we find out they don't have the same perception of what we've accomplished. So it really is helpful and beneficial to get those lived experiences from the state. We've had regional recovery-oriented system of care summits, co-hosted with partners that not only address the concerns from those town halls, but also introduce the idea of community mapping at the local level. I know I've often said, as a lot of speakers here, I've often heard over the years, we just don't have A, B, and C in Kentucky to do this. And I think we're blessed with a whole lot more help, services that are available to us. It's just we have to figure out where all of it's at out there and try to pull it together. And that's one of the wonderful things I think this committee's been able to accomplish. We have a unique local mapping model launched, making it possible for the commission's mission to move from broad state strategies into tangible, community-driven solutions. We've got the ideas across the state, but now we're breaking them down to where we can take them back to our own regions and implement them. And so proud of the groundbreaking legislation that we have achieved in the last couple of years. In 24, we had Seth's Law. And in 25, we had Senate Bill 26, cementing real system changes into the statute. We've had 3 committees and 10 active work groups established, bringing together over 400 professionals and individuals with lived experience to tackle barriers and design practical and effective solutions for some of the problems the people of Kentucky deal with on a daily basis. We've been able to obtain a wealth of resources. We've had a wealth of resources published and shared, really too many to name here, but each one was crafted to help our courts and communities better respond to individuals with these behavioral health needs. We've had national recognition earned as Kentucky continues to emerge as a leader in impactful, innovative system changes. I know the Chief Justice sits on it, but on the National Council of Chief Judges, often I'm amazed, and they're amazed when we sit and talk and actually compare what our state has implemented, what's attempting to implement. And we really are, I believe, at the forefront of a lot of these programs. And perhaps most importantly, a collaborative partnerships of 84 extraordinary organizations and individuals, all seated at this table. Each one of you has been essential to this progress. I can tell you right now, if I had to guess, I'm looking at a room full of type A personalities, overachievers, and probably each and every one of you are sitting there going, I've got a million other things I can work on or need to be doing, but yet you find time to dedicate to this commission. And on behalf of Chief Justice Lambert and Deputy Chief Justice Conley, we appreciate you so much. And I've found after 30 years of service in Kentucky, we don't often give raises, but we can sure brag on people. So I have the ability to brag on you, so I am going to brag on you a little bit. 3 years ago, this was just an idea, and today it is a movement. None of these successes I've just detailed to you would have been possible without the energy, dedication, and creativity that each and every one of you bring to the table with us. It's such a diverse group. Your voice matters, your presence matters, and I truly believe that the work you're doing on this commission matters. So today, as we celebrate this anniversary, I want to thank you for your continued commitment and for the inspiration you provide, not only to me, but to one another and to the people we serve across Kentucky. You know, often I said when I was a district or circuit judge, I said, sometimes you feel like you're on an island out there by yourself when you're trying to deal with these problems. It is just so nice to come into a room filled with this many professionals, knowing each and every one of them has the same desire, and that's to help those that come in front of our system that have mental health issues. And again, we appreciate it. I also want to thank, and especially want to thank Chief Justice Lambert and Deputy Chief Justice Conley for the many hours they've dedicated to the success of our committee. I promise you, I have seen Chief Justice Lambert's schedule. How she finds time to find her house in the evenings, I don't know, much less to make it to make it here. And we all know that the majority of the work she does for this committee doesn't occur in this room. It occurs throughout the state with the legislator, our legislative partners, and all the communities. So Chief, on behalf of everyone in this room, we thank you so much for your tireless dedication that you have devoted to this committee in the commission these last 3 years. Now that I've congratulated everybody, and I hope I haven't missed anybody, in your materials today, you're going to find today's agenda, the minutes from our June meeting, and an updated structure for your reference. We'd like to take a moment to extend our appreciation, excuse me. I'm sorry. Okay. I got to turn up my hearing aid. I always like it. I'm editing my notes on the fly here.
Sorry, guys.
I might as well give her that microphone there. She does far better. We'd like to take a moment to extend our appreciation to Secretary Stephen Stack with the Cabinet for Health and Family Services, who has graciously agreed to step into the vice chair role for the Treatment and Access Committee. I'm not sure if it was stepped into the role or was pushed into the role. Sometimes in state agencies, we find that to happen, but however we got you, we're very happy to have you. I'll say that. Your passion and dedication to this work are deeply valued by the committee and commission, and we're confident that your leadership will strengthen the committee and the progress we make with mental health and mental health treatment in the state of Kentucky. So on behalf of the rest of the commission, we're so thankful to have you with us in the work that you are doing and will be doing. Also included your materials today is an updated committee listing. As a reminder, committee participation is reserved for commission members only. Committees meet on a quarterly basis to hear updates from their assigned work groups and to provide strategic recommendations on work plans. They also help guide resource development, support work group members as they move forward with implementing effective solutions to the problems that we're dealing with. If you have any questions about your committee assignment or need details about the upcoming meetings, please don't hesitate to reach out to Shauna, Maria, or Heather. Now, earlier, I bragged on Chief Justice Lambert and Deputy Chief Connolly, but I also have to brag on this person to the right of me for the tireless effort she puts into keeping us on track. So, Shauna, thank you so much. And she sits up here going, please don't say that stuff. During this quarter, we have completed 14 virtual forums, serving citizens through the 202A process. For those unfamiliar with 202A, it refers to the status that govern emergency mental health evaluations and involuntary hospitalizations for individuals experiencing a mental health crisis. These statutes touch nearly every system: judicial, legal, medical, and behavioral health. And these forums were designed to bring all of these perspectives into one space. For those of you that know me, after 30 years, I'm always telling war stories on myself, but I can tell you as a district judge, the 208 process was always troubling. And the best example I can give, we had the state police bringing someone that had had a 202A filed against them, and they need the district judge to sign. They're driving around my neighborhood, could not find the district judge, and the mental patient says, if you're looking for Judge Thompson, he lives in that first apartment. So I thought to myself, when the mental patients are giving directions to my house, it may be time for me to move in the neighborhood. But I've always thought that the 202A process was so important, and it really needed to be addressed by us. Over the course of our 14 regional sessions, invitations were extended to district court judges, circuit court clerks, county attorneys, sheriffs, jailers, community mental health center leaders, state psychiatric hospital staff, county judge executives, hospital representatives, and law enforcement officials. In total, 553 individuals participated. Honestly, I think that's a pretty amazing turnout we had with that. The forums provided an opportunity to examine the current process, identify shared challenges such as workforce shortages, transportation barriers, and lack of coordination, and to highlight promising practices that are already working in some areas of the state. Often it's just figuring out who's got something that's working and sharing it with each other. And that has been so vital to this commission. These conversations were difficult, but necessary. They created a safe space for honest dialogue across systems, grounded in the shared goal of improving Kentucky's response to individuals in crisis. The follow-up survey will remain open until the end of September, giving participants and those unable to attend a chance to share additional feedback. The commission will then compile the survey results and the themes from the forums into a comprehensive report that will be distributed to each of you. This body of work will not move under the priority of the commitment work group. This body of work will now move under the priority of the commitment work group, where findings will be used to develop actionable solutions, inform judicial and stakeholder training, and guide potential policy recommendations. We extend our sincere thanks to Commissioner Katie Marks and her team for their help in planning. Commissioner Katie Marks and her team for their help in planning and executing these forums, as well as to all commission members who attended together. These efforts are setting the stage for meaningful change in how we deal in the state of Kentucky with involuntary commitments, moving us toward a system that is more coordinated, compassionate, and effective for those we serve. You know, I've heard over the years, judges say we're just not on the same pages. I've heard social workers and mental health workers addressing us saying, we're just not on the same page. Hopefully, by the time this commission progresses and implements new legislation, we will be uniform and implementing and all be on the same page and coming to deal with this. You know, and looking at,
Oh my gosh, I'm so sorry.
Oh, boy.
wow.
I
Want me to-
thought, I just literally turned it on
I-
silent.
I'll do you like I do the judges or the attorneys.
Here, take
Want me
it.
to answer it for you?
Security is outside.
That's a pretty shade red. I will tell this one on me. As I said, I tell war stories. We were doing oral arguments and, you know, we're concerned in Kentucky now about AI. And unfortunately, I'd talk to somebody, I always leave my cell phone in my office. Attorney makes a lovely argument about a case to me and how significant and how important the law is that was shown in that case. And I forgot I have a smartwatch on. Had nothing to do with what the attorney said, but right over the speaker, it says, I believe that's an incorrect statement. Well, the response was to something I'd texted somebody, and all of a sudden the attorney looks at me and he goes, well, let me explain why it's correct. So he spends the next 15 minutes correcting my watch, and my watch wasn't talking to him. He was talking to me. So don't feel bad. It could have been worse. It could be worse. We'll now go on to our community mapping. We continue advancing our community mapping initiative with a strong local engagement. Most recently, Lincoln County hosted a mapping workshop on September 5th, bringing together 49 participants representing over 26 agencies. From that session, 3 concrete action plans were developed: expanding access to safe and affordable housing, increasing transportation resources through funding and accessibility strategies, and improving resource awareness and coordination to strengthen collaboration and streamlining communication. Each priority team has already scheduled follow-up meetings and assigned tasks to ensure progress continues. Looking ahead, the next community mapping events are scheduled for Clark County on December 16th, 2025. Ready for that one, I'm sure. Hardin County on January 29th, 2026, and Henderson County on February the 3rd, 26. As of September 25, a total of 12 counties have hosted mapping workshops, resulting in the creation of 25 localized action plans to guide system improvements. In your materials today, you'll find a full community mapping update, which also provides information around emerging themes. When you get a chance, and I know sometimes you have to feel like you're inundated with paperwork when you come in here, but when you get a time sometime later, sit down, take a look at that information, and remember to share that. Community mapping is available for all Kentucky counties. We want all counties to buy into what we're trying to do here because it does benefit all counties. Heather is leading that initiative with the commission and is available if anyone would like any more information. We have talked for some time now, as most all of you know, and I know we have some representatives and legislators here. Our upcoming legislative session will begin in January, and it's a very important session. Of course, most of us sometimes tend to focus on the funding aspect of the legislation, but they also have a lot of other areas that they deal with. And one of the important for us this year, and I think it's our 2026 legislative package dealing with the KRS 202C. Our package will prioritize reforms to the KRS 202C. And all of you know that, but that's the statute that deals with involuntary commitment of individuals found incompetent to stand trial. These truly are among the most complex our court face, balancing public safety, constitutional right, and treatment needs. I can tell you that is probably an understatement when you look at the rights that become involved with the possible involuntary hospitalization. And I've had people look at me, it's only a few hours. I bet I would be complaining if it was my few hours they were looking at. So highly crucial and very important. We were invited to present at the interim joint committee of the judiciary, beginning early conversations with legislature about the barriers that do exist within the current 202C process. That discussion made clear how urgently stakeholders want clarity and consistency in this statute. Truthfully, across the board, I think everybody wants to help. And again, it goes back to what I said earlier. We just have to all be on the same page as how we're going to provide that help. In addition to the competency work group's leadership, we convened a focus group of key system partners to ensure consensus among those most directly impacted. We are grateful for their time and expertise. And if you bear with me, I'd like to go over some of the names that are on that. Honorable Christopher T. Colron, 8th Judicial Circuit, Division 1, from the Circuit Judges Association. Honorable Cole Adams, Judge, 25th Judicial Circuit, Division 2, Circuit Judges Association. Ramsey Dallum, Deputy Director, Special Prosecutions Unit, Office of the Kentucky Attorney General. Brian Wright, 29th Judicial Circuit, Commonwealth Attorneys Association. Rob Sanders, 16th Judicial Circuit, Commonwealth Attorney. Joe Ross, President of the Kentucky County Attorneys Association. Damon Preston, Kentucky Public Advocate, Department of Public Advocacy. Beth McMahon, Post-Trial Division Director, Department of Public Advocacy. And Greg Colson, Colson Law Offices, Guardian ad litem. Together, this group reviewed the statute, identified areas in need of reform. Some of the areas that they focused on included clarification on guardian ad litem appointments, discharge planning and continuity of care, jurisdiction, terminology, due process protections, and evaluation procedures. Their input has shaped the draft recommendation that you now have a copy of before you. We have provided in your materials an overview of the legislative recommendations as they currently stand. At this stage, these proposals are presented for your final review and approval. If you have any concerns about any of this moving forward, please let Maria know immediately as she looks over. She's got that look like today if possible, but honestly, we are under time constraints as meetings with the legislatures are already scheduled for this week. This is a final opportunity to provide input before these recommendations are presented to the legislators. It is my pleasure today to produce our speaker. I asked when I came in if he was sitting up there with all of his friends, but it is my pleasure, honestly, to introduce Zach Ramsey, the Director of the Kentucky Administrative Office of the Courts. Zach brings with him more than 25 years of experience in government healthcare, and since joining us, he has demonstrated unwavering support of the Kentucky Judicial Commission on Mental Health. His leadership and commitment have been instrumental in advancing our mission. And I can tell you personally from the Court of Appeals, he's addressed about every group we can get him in front of to talk about this for. So we appreciate that. Today, Zach will be sharing exciting news about a new position created to help the commission implement changes across the state. And I would ask each and every one of the commission that's with us here today if you would give a warm welcome to Zach Ramsey.
Thank you, everyone. Good afternoon and welcome. And thank you, Chief Judge Thompson, for the remarks and to the commission and some of my teammates at AOC giving me the opportunity to present today, as Chief Judge mentioned, on a newly created role within our Court of Justice, the Behavioral Health Liaisons, the BHLs. And we have, I think, all of them here today. I believe I'm counting them in the back of the room that have joined us today at AOC, and we'd like to welcome them And at the end, we'll certainly open it up for questions and an opportunity to have any type of discussion that we may want to have around that. But I'm here today to share with you more of the development, some of the history, the development and implementation of this newly created role. And this aligns directly with our goals as commission members and the commission itself to support advancing compassionate and coordinated responses to justice-involved individuals experiencing mental health and/or developmental and intellectual disabilities. As such, I'd like to provide an overview of the development of the BHL role, highlight the significance and implementation to date, and share its impact we're already having on individuals we collectively serve and how it's enhancing coordination across all our internal and external partners. Before we do that, we'd like to take the opportunity to give a little background on the Administrative Office of the Courts, the AOC. Many of you certainly are probably aware of a lot of this information, but we are the operational administrative arm of the Kentucky Court of Justice. Our unified judicial branch of government includes all our state courts, all the programs and services, all the diverse and innovative programs that we have that support our courts. Of course, all our justices, our judges, and our clerks. This totals nearly 3,300 employees, 412 elected justices, judges, and circuit court clerks across the Commonwealth. And also, as many of you know, our judicial branch over the years has gained national recognition for innovative programs such as family court, drug court, mental health court, judicial education, our first of its kind pretrial services, juvenile justice reform, our court interpreting and language access services, among many others. And as some of you may know, we'll soon be commemorating our 50-year anniversary as a unified system since the Judicial Act finalized all this in early 1976. And so please be on the lookout for information coming out commemorating and celebrating that as we go forward. And as always, the judicial branch is committed to ensuring fair and equal treatment for court personnel and all who come before Kentucky courts, regardless of race, gender, religion, ethnicity, or sexual orientation. And I want to thank Debbie and the commission and Shauna and Audrey and Elizabeth and everybody who kind of scripted some of these comments for me. I'm going to take you through the timeline of how we got from there to here. Most of it predates my role here with AOC. So I'm going to take you through some of this information that highlights some of the information that's come out, some of the things that we've assessed and why we pivoted to the BHL role. So in 2020, the AOC began to seriously examine how the state's court system could align more closely with the recovery-oriented system of care principles, as we were seeing this trend develop nationally for other state court systems. So to move forward and truly support this, AOC applied for and received a federal grant to evaluate how the court system was responding to individuals with behavioral health issues. The outcome of this grant was a comprehensive report issued in 2021 by the Crime and Justice Institute entitled Recovery-Oriented Systems of Care, Needs and Opportunities for Kentucky's Court System. And the report identified several challenges, including limited coordination between courts and treatment providers, a lack of a unified approach across our AOC departments and programs, which could lead to inconsistent recovery strategies, and a growing awareness of the prevalence of substance use and mental health issues, accompanied by a need for continued education and collaboration across communities and systems. In response to the report, and also in 2021, AOC combined its 3 direct service departments, which are our specialty courts, pretrial services, and family and juvenile services, into a single office of statewide programs, which, as many of you know, Debbie Hall is our executive officer. This reflects the principle that we work better when we all work together. So building on this momentum, and as Chief Judge Thompson pointed out in his introductory remarks, this commission, the Kentucky Judicial Commission on Mental Health, was created on August 11, 2022, 3 years ago. And the commission is tasked with exploring, recommending, and implementing system-wide reforms for justice-involved individuals with mental illness, substance use disorders, and intellectual and developmental disabilities. And its key responsibilities include developing a strategic plan to strengthen the court's role in behavioral health, identifying and addressing current and future needs to improve outcomes, enhancing collaboration between our courts and behavioral health stakeholders, and educating the public on how to access court services and these programs. So in 2023 and in 2024, the commission organized a series of statewide initiatives, including the Mental Health Summit, various town halls, and a recovery-oriented system of care summit. These gatherings highlighted 5 pressing issues that we needed to address. We had gaps in adult community-based care. We had gaps in youth community-based care, behavioral health treatment, gaps in detention facilities, sentencing and diversion reform, and also involuntary commitment of minors. So in 2024, you can see from the map that shows the current coverage map, what set this up was state funding was allocated to establish these 8 regional behavioral health liaison regions across the state. This represented a critical investment in the ongoing modernization of our court system. And modernization is not just new technology. The initiative reflects the state's commitment to strengthening collaboration between the courts and the community-based behavioral health services, ensuring a more integrated and effective approach to addressing complex needs. So by improving communication, coordination, and service delivery, these regional liaisons play a pivotal role in bridging systemic gaps and connecting courts, community providers, and justice-involved individuals to essential behavioral health resources. This enhanced infrastructure not only supports individuals and families, but equips our court system with innovative tools and partnerships to deliver a more informed, person-centered outcome. Through the development of the BHL role, the state is advancing a forward-thinking model that promotes efficiency, fosters equity, and positions our judicial system to better respond to the growing behavioral health challenges impacting courts and communities statewide. This highlights 3 key areas of focus that we have for our BHLs. They work within our judicial system, providing a vital link between our mental health system, our criminal justice system, and our communities. And their role is designed to improve outcomes for individuals with behavioral health needs who are involved with or at risk of entering the justice system. The first key area of focus here is judicial system navigation. The BHL assists individuals experiencing mental health or substance use challenges in navigating the complexities of the criminal justice system. This includes helping clients understand legal processes, connecting them with legal and behavioral health resources, and advocating for alternatives to incarceration when it's clinically appropriate. The second area, cultivating and enhancing community partnerships. The BHL plays a key role in building and maintaining collaborative relationships between the justice system and community-based behavioral health providers. These partnerships enhance cross-agency coordination and ensure justice-involved individuals have access to appropriate services such as housing, outpatient treatment, and case management. And the third is crisis intervention. When individuals, families, or communities face behavioral health crises, the BHL can facilitate coordinated crisis intervention. This may involve connecting individuals with crisis stabilization services, emergency mental health resources, mobile crisis units, thereby promoting safety and reducing unnecessary incarceration or hospitalization. And as I pointed out, I think they're here in the room, but this is a photo of all our new BHLs together, I believe, after a recent tour of Western State Hospital. We also have Audrey Collins and Elizabeth Nichols, our specialty court department leaders, with them. So what this slide's going to go through is some recent examples that our BHLs have already facilitated and fostered since they've been with us, showing their impact, the impact they're having on our communities and our systems. First example, our BHLs coordinated with a Western State Hospital social worker to prevent a failure to appear for a hospitalized patient by notifying the court and updating the hospital on new court dates, bridging the communication between the legal and clinical teams. Another is the BHL connected Kentucky River Community Care with key community partners, including the Whitesburg Police Department, local EMS, and the court on education regarding suicide and 988 resources. The third is the BHL collaborating with Highland ARH Hospital and the courts to ensure the individual at risk was placed in appropriate care to continue prescribed medications, also ensuring a least restrictive environment. Kind of putting the entire role of the BHL together here, capturing the current scope of engagement that they are playing. showing on the left our internal contacts as far as the holistic view of all the collaboration and coordination that they're doing. On the left, you see our KCOJ and AOC community, judges, court staff, AOC personnel who rely on the BHL for guidance and collaboration. And the support here in this communication line helps the courts navigate behavioral health concerns, diversion opportunities, appropriate referrals. And on the right, you see the external partners, external contacts. Some of our examples, certainly not all, community partners such as treatment providers, law enforcement, advocacy groups, and local service agencies. And here the BHL serves as a connector, ensuring individuals have access to appropriate behavioral health and recovery supports. So it's a dual role, functioning both as an internal court resource and an external systems liaison. It's holistic, bridging gaps and aligning courts with community-based services. And it's about addressing today the gaps that we know and while continuing to assess, for additional gaps to be addressed in the future. And the impact, the volume and diversity of these contacts demonstrate the BHL's central role in fostering this collaboration, but also building trust and overall advancing a recovery-oriented system of care. So the key message is this position is not just about case level support. It's about creating sustaining relationships across the justice and behavioral health systems. The next slide, always my favorite part of a presentation. We get to watch a video and it's extremely well done. I've seen it before. I'd like to thank Deputy Justice Conley for his participation and speaking in the video along with our BHLs and other individuals who helped put this together. But it's all part of our official release and announcement of the creation of this role, which starts today, first and foremost, to this commission. And the video that we're going to show is going to be included in the upcoming press release materials that will go out to all. And I think the launch will be accompanied by an additional comprehensive media package. In addition to the press release, we'll have news articles, social media outreach. But of course, it was important that we share this message and this milestone with you, the commission members, first. As through its work groups, it's this commission that has identified the significant gaps in how justice-involved individuals access this support. And these new positions are designed to directly address these needs. So I'm told that the video will play immediately when I go to it. One more click. Okay. That's fine.
On behalf of the Kentucky Supreme Court and as chair of the Kentucky Judicial Commission on Mental Health, I'm proud to introduce a vital new resource for our courts and our communities, the Behavioral Health Liaison position. Created by the Kentucky Administrative Office of the Courts, this initiative reflects our deep commitment to improving outcomes for individuals with mental health needs, substance use disorders, and intellectual and developmental disabilities. We're excited to share this with you and to continue building a more informed, compassionate, and coordinated system of justice in Kentucky.
Behavioral health liaisons are helping create stronger and healthier communities by connecting individuals to the support services they need. Through collaboration and education, we are able to help bridge the gap between local community agencies and the judicial system.
In Kentucky, behavioral health liaisons serve as a connector for the judicial system and community resources. This encourages early identification for individuals with behavioral health needs and connecting them to the appropriate service. This can save valuable resources that may otherwise be spent on incarceration or hospital stays.
We want to support and connect those who are justice involved in order to meet their behavioral health needs.
We know that navigating the justice system can be challenging, especially for individuals that are facing complex behavioral health needs. We help guide the individual through the process and explore alternative options that may best suit the needs of each individual.
Behavioral health liaisons engage with the community by participating in local boards and committees. This helps us build stronger relationships and better understand our communities, as well as assist individuals involved within the justice system. Since each community is unique and resources can differ, this helps us spot service gaps, offer solutions, and promote communication between agencies. This allows us to tailor our support to help both the community and individual needs.
Each person's experience with the justice system is unique and different. And sometimes individuals need a personalized approach in order to succeed. We can connect individuals to the right supports for their behavioral health needs with not only our knowledge of the justice system, but with our connections with community resources. We can also assist families who may not be directly involved in the justice system, but whose loved one or family member is facing challenges in the system.
Our behavioral health liaisons have already begun to bridge critical gaps, connecting courtrooms with community-based care in ways we've never seen before. We look forward to the continued impact of this work as we strengthen Kentucky's justice system by working together with compassion and innovation. Thank you for watching. For more information, visit kycourts.gov or scan the QR code provided here.
Thank you. And the next slide brings that QR code back up that Deputy Chief Justice Conley showed at the end of the video. First, as a group, you'll see the BHLs going forward, continuing to support this commission with community mapping, commission work group supports, and overall driving the mission of improving compassion, connection, and collaboration with those who have mental health and/or developmental and intellectual disabilities. As was just mentioned, the QR code you see here is going to be part of our marketing campaign to connect persons to a BHL. When you click on the code, it will assist you and triage to your BHL resources. And this will be included in your materials along with the BHL coverage map shown earlier. That'll all be part of the press release and the materials going out. So thank you very much. And on behalf of the AOC and as a member of the commission, I want to thank you for your continued commitment to this commission. We have many of our BHLs, or all I believe our BHLs with us today, in addition to leadership from the AOC Office of Statewide Programs. So we're all here and we're happy to take any questions that you may have. Thank you very much.
I guess first and foremost, does anyone have any questions for Zach this afternoon?
Diamond Dog.
Good afternoon, Zach.
Yeah.
So this is a wonderful program, and this is great. I could absolutely see it filling gaps as the presentation said. I'm wondering in practice, how is this going to interact in a pending case? We have alternative sentencing workers, and one of your BHLs is a former ASW, so we know that you're hiring good people because we've trained them.
Mm-hmm.
But how will it work if our ASW presents a plan, if probation and parole presents a plan, will the BHL be involved in that stage, or is it later once a person before the court is released on a diversion plan or a probationary plan?
It's my understanding that they will, but I think Audrey's right behind you to give you the better information.
Yeah, so thank you, Damon. The plan is not, or the role will not replace the work of the ASW, but rather complement it. And so think of the BHL as kind of that resource hub to even assist your alternative sentencing workers or assist throughout the process. So really they can help at any stage. So it may be a family member calls and says, hey, my daughter's in jail. I can't get a hold of her attorney and I want her to get help while she's going through this case. The BHL may take that call, field that call, reach out to the ASW, and then help bridge those connections. Yeah.
Do we have any other questions? Zach, I want to thank you today for sharing with us one of the updates from the administrative office of the courts. And I'm one of the first ones to always say the administrative office of courts have always been so supportive of the judicial system, obviously across the Commonwealth of Kentucky. And you have been an avid supporter of this commission, and we greatly appreciate the work that you and your wonderful staff here does for us. Also, I want to congratulate our behavioral health liaisons. If they're here, we want to welcome you. We think you will be a wonderful wonderful addition and assist to our local communities out there. And we appreciate so much you being with us today. All right, then, if we don't have any other questions, then
Thank you, sir.
Zach. We appreciate it greatly. We'll now move on to our committee and work group updates. We've also already provided for you in your materials the quarterly reports for all the work groups. Additionally, you'll find an updated commission structure for your binders. Up first this afternoon, we welcome Amy Luttrell as the chair of the Treatment and Access Committee.
All right, thank you, Chief Judge Thompson. And I also want to add my thanks to Secretary Stack for agreeing to be our vice chair, and we all certainly look forward to working with him. And then, of course, every time I have to thank Maria Macaluso because of the very strong support that she provides to all three of our work groups and to me. So thank you so much, Maria. And then we also appreciate you very much, Shauna, because we know you're in back of all of this, keeping it running like it needs to be. All three of our work groups are active, and our chairs are very invested in the need to make these systems better for people who get caught up in our criminal justice system, and they are all three doing a great job of leading their groups. All of them, among their other work, are reviewing and discussing their work plans to make sure that those work plans remain relevant to the work that the work groups are doing. All three of our chairs are with us today, and I appreciate that. So I'm going to let them ask them each to speak to the work that they have been doing. And we'll start with Crystal Adams, who is chairing our Intellectual and Developmental Disabilities Work Group. So Crystal, I'll pass this over to you.
Thank you. So you've heard a lot today about 202A and 202C, and so now I'm going to pick up with 202B. Our work group has worked on developing a training to folks within the court system on KRS 202B. Similar to KRS 202A, it can sometimes be a complex process. There's a lot of overlap, but also many differences between the two processes. What is very different is the volume that we see with 202B, which is a good thing. It's much smaller. But because of that, it's not uncommon for clerks or judges to see one of those petitions for the first time ever. And so we wanted to make sure that when those do come across folks' desks for the first time, that they do have that foundation of information that they'll need, both in terms of the process itself, but also the statute and the important legal references behind it, so that they'll be prepared when they do encounter a situation where they're going through that petition and certification process. We are very excited to have that developed. We presented on it to the work group to get additional feedback, and we are hoping to finalize the recording and make that available very soon. Our next step in that process is that we hope to develop a bench card to provide quick reference for individuals to refer back to in the moment. Like I said before, it may be some time before one will come across their desk, and we want to put the key information at their fingertips, whether it's which form is which or where the legal references are that they might need to look at to make sure that they understand what needs to occur and make that as simple for them and other folks as possible. In addition to that, we've continued our work on autism in the courts. We have two primary trainings that we're working on at this point that are well into development. They're very comprehensive. We're very excited about these trainings and hope to be able to finish those in the near future. We work very closely with a group of self-advocates and attorneys to identify what the needs are and develop these trainings and ensure that they are useful both for individuals with autism as well as individuals within the justice system who want to provide assistance to individuals with autism through the legal process. We're also continuing to work on the implementation for Senate Bill 26, which of course was our very successful legislative agenda item that we had last session. And we're very excited to continue to support DCBS with that implementation process. we met and we were able to gather recommendations and questions that community partners had for DCBS and provide that information back to them about implementation. And their DCBS is working very closely with us to provide additional information here in the near future on what that process looks like from their side and how we can continue to support them and make sure that that implementation is successful through our work in the Justice Commission. And that's all I have. Thank you.
Any questions for Crystal before we move on? Okay, well, thank you, Crystal. And you can all tell that there is a great deal of work that gets done in between these work group meetings. So congratulations to this work group for all the progress that they have made. Next, I will call on Judge Stephanie Burke to give us a report from the Court Responses Work Group. Judge Burke?
Thank you, Amy. We also would like to thank Maria for all of the help that she gives our committee. I could not do this without her. The Court Responses Work Group continues to explore court initiatives which are aimed at improving outcomes for the justice-involved individuals who are experiencing behavioral health issues and substance use issues. We also are developing pertinent educational materials for judges and court personnel. We continue to monitor developments and expansion of AOT across the state, and we're going to continue to support efforts to secure sustained and increased funding for those programs. We heard from Dr. Sussman at our last meeting of how that expansion is going, and I'd like to report that it has continued to move forward very rapidly, even since that meeting. And we are hopeful that in the upcoming General Assembly session that we will be able to secure funding to expand statewide to meet 100% of Kentucky's population. Also, we continue to explore strategies to simplify the filing of Casey's Law petitions. We hear repeatedly that this process is complicated for families. It's complicated for justice partners who don't see uniformity in the different courts and jurisdictions, and we are working to address that situation. Our committee is going to meet again on October the 7th, November the 4th, and December the 2nd at 3:30. And we expect to be very busy going into the session for 2026. Thank you.
Any questions for Judge Burke? And Judge Burke, I'm gonna put you on the spot a little bit because I know you mentioned to me a little while back as a result of some of the changes that have been made here in Kentucky, how Kentucky had kind of risen in the gradings on our treatment of people with
the grading the states?
Yes, yes.
So
could you just share that with the group?
So the Treatment Advocacy publishes a manual document that they basically measure states' legislation. They grade the legislation based upon how they treat mental people with behavioral health issues in that legislation. Kentucky's grade improved significantly with the adoption of AOT. And the only place where we're actually have a shortfall in points is in the 202A process. And so hopefully in this next session, all of the efforts that the chief has focused on in the interim, we will be able to make changes and get, raise our grade even higher with modernization of that statute. But Kentucky has been able to raise our grade to a much higher level through the adoption of AOT. And we received all of the available points in adoption of our statute with the last revision of that.
Thank you. And I'm sure some people in here already know that, but I was gratified to hear it and thought it would be good for everyone to hear it in case you don't know it. Thank you, Judge Burke. And then finally, I'll call on Dr. Lindsay Jasinski, and she and Dr. Mark Woods just took over co-chairing our Strengthening Communities work group a short time ago, and work group has had two very active meetings since that time that I know have been exciting to us, that are observing, attending, and supporting those meetings. And I think Dr. Woods is not with us today, but Dr. Jasinski is going to give an update for us on what that work group is doing. Dr. Jasinski.
Yeah, thanks, Amy. Thanks, everyone, for having me today. I also wanted to echo the thank you to Maria and Shauna and Josh and everyone who helps support these committees. It really is an amazing amount of work that goes into getting these committee meetings scheduled and the agendas out and all of that. So we greatly appreciate that. Like Amy had said, we recently took over leading this group and have met twice since then. We met in June and August. One of the things was sort of a refresh of our priorities and our work plan to look at, what do we want to focus on moving forward? So we've had quite a bit of discussion around that. In tandem with continuing forward with the training on for courts on the use of medication for opioid use disorder, and creating that as an educational tool, but also as a tool for stigma reduction to ensure equity of access to MOUD in the court. So that training has been completed. It is a truly wonderful conversation and video. It's about 40 minutes long, and I think folks are going to really enjoy it. We are now in the final stages of sort of approving that training video, and that was done by Judge Hayes Spedding and Dr. Anna Maria South. So they did a really wonderful job, and excited to share that with everyone. In an upcoming meeting, which is actually our next meeting is next week. And then we've got another one in October. We'll be hearing from a presentation on the national survey about MOUD treatment in jails. That can be a gap as well when folks are coming in and out of systems, ensuring that they have access to treatment services that are going to help keep them stable and in the community. So excited about that. And we spent some time in our last meeting. Since we took over in June, this meeting, there's been a lot going on at the federal level that certainly is going to have some impacts on access to treatment and overall stability for many of our folks who want to remain in the community. And so we had kind of a high level discussion about how do we think these things are going to continue to impact us, so that as we're working through our work plan, we can strategically identify some of those priorities that we think are going to have the biggest impact for our folks moving forward. So that was a really robust discussion. And then we also had some really good discussion around just the language that we use and the forms that we have built and things like that, and how can we reduce stigmatizing language for substance use and mental health in our paperwork that we fill out and some of those things. So that's on our work plan as well moving forward. So I think that's it. We're excited for our meeting next week, and if anyone wants to join, let us know.
Questions for Dr. Jasinski, anyone? Okay, again, I want to thank all three of our work group chairs for their hard work, and we'll turn it back to you, Chief Judge Thompson.
All right, then. Thank you so much, Amy. I think it truly is an understatement to say you guys have been busy this last quarter, and we appreciate so much what you and your work group chairs have done and accomplished, and thank you so much. We'll go to our next committee, and that's with Judge Cutoff for the Civil and Family Justice Committee. And I think Foster's joining us. He appears as we speak.
Good afternoon, Chief. How are you doing?
Fine.
Well, I apologize for not being there in person. I had my mental health court meeting this morning, and we meet every other week, and for that group, it's pretty important for me to be there. So I had to take care of that, but I'm here now. So here to report for the Civil and Family Justice Committee. I do also want to echo everybody's thanks. We're like broken records here, but Maria and Shauna and Rebecca kind of keep us in line. And my co-chair is Chris Griffith, and he does a wonderful job. And Dolores Smith helps get our committee meeting together. So I really appreciate their time and their efforts to help our committee. The last time we met was September 3rd. The summary of that meeting is pretty simple. Our work groups are remain focused on advancing their different work plan priorities. And the key areas for those different work groups include conducting trainings on collaborations with systems partners, reviewing AOC forms to streamline Kentucky's court processes. And as a judge, I'm all for that. And they are also in the domestic violence group developing a bench card on Kentucky batterer intervention programs, which you can find in your meeting materials. Without further ado, I'm going to call on Judge Vanover, family court judge from the 28th Judicial Circuit. He is the chair of our Dependency, Neglect, and Abuse work group, and he is online also. So Judge Vanover, if you give that report, please.
Okay. So our DNA work group met August 19th, and we discussed the 4 areas that we're mainly working on. Our enhancing collaboration with community partners group is working on a series of trainings known as Relationships Matters. These are training services that will not only for court staff and attorneys, but also for community partners and others who are working with the court system in our DNA cases. Let's see. The first one of those sessions took place Professionalism and Respect on August 20th. There is another session coming up September 24th, Promoting Resilience to Prevent Secondary Toxic Stress Syndrome. Another session October 22nd, The Power of Positive Experiences. And then November 19th, Increasing Understanding of Medications for Opioid Use Disorders. And finally, a session December 17th on High Acuity Youth. Anyone interested in registering for these can let us know. We'll make sure that you get links to do so. Let's see. Our second group is working on understanding the role of treatment providers. We are pivoting a bit from developing it as a bench card to be used by judges to creating more of a frequently asked questions pamphlet that can be shared more widely with our providers and with our community partners. The resource guide or the frequently asked questions resource will have about 9 questions and we aim to have this finalized by November meeting. Large part of the work was done with the original bench card idea, so we're tailoring it just toward a more wide audience. And we think that this will serve as a supplement to our best practices guide once that is fully developed. Let's see, the best practices guide that we're working on. We're continuing to work with edits and expansion into a broader guideline, including resources for families involved in dependency, neglect, and abuse cases. The group is pausing additional work while determining whether or not the new FAQ should be incorporated. And we think that guide is close to completion. So, once we get the FAQ part done, we think that we'll be well on the way in having that finalized. Finally, we have groups working on enhancing training for court-appointed counsel. We had trainings in the spring and summer, in May and June in London, Hopkinsville, and Frankfurt. More than 130 attorneys attended those sessions. Follow-up training are scheduled. We will be having training November 7th in Covington, November 15th in Lexington, and November 21st in Paducah. Right now, the faculty who are responsible for doing those classes are reviewing feedback from the prior sessions and trying to figure out what we can do better and make sure that we are properly educating our court-appointed counsel and our attorney and guardians ad litem on the nuances of dependency, neglect, and abuse cases. Let's see. So we also our group had focused on discussing some legislation that's going to be moving through regarding reforming the guardians ad litem process. We are not going to be leading on that. However, we continue to work with a couple of other groups, Kentucky Youth Advocates, the Judicial Engagement Work Group, and legislative committees on trying to have input on how we can more appropriately structure our guardian ad litem guardians ad litem practice, focusing on training and, more importantly, perhaps recruiting guardians ad litem in parts of our state that are having shortages. So there's lots of talk about how that's going to look, and it's kind of new in the discussion phases, but we're continuing to work with groups on that. It's looking like implementation of the restructure could take possibly a period of 2 to 5 years, however it may proceed. Big portion of this is going to be dependent upon budgetary issues. But in the meantime, we're continuing to advocate, while that is rolled out, advocate for maybe a separate bill that would be proposed to temporarily increase guardian ad litem and court-appointed counsel pay while the overhaul of the entire system gets worked out. Our next DNA work group meeting will be on November 18th. And anyone who wishes to join us is welcome to do so. Thank you.
Thank you, Judge Vanover. Does anybody have questions for him about his work group? Judge Vanover does great work. They meet a lot and they discuss a whole range of topics, and his work group has done some great things. So I appreciate him and his work group very much. Without seeing any questions, we'll move on. I have some good news for you, folks. I'm going to ask you to read the next 2 reports in your materials, because Judge Denise Brown with the Domestic Violence Work Group was unable to be here, and Stacy Tapke with the Guardianship and Commitment Work Groups, she was also unable to be here today. So we're going to let you read yourself, so I'm not going to read them to you. So you're welcome for that. So Chief, I think that's all we have with the Civil and Family Justice Committee. But real fast, before I leave, I did want to say that I want to echo the director's talk about the behavioral health liaisons. Our mental health court started here in Christian County earlier this year, and we could not have done that without Janice Cunningham, who's the first region behavioral health liaison. She does incredible work. So I know the rest of them do the same, but Janice works right down the hall for me, and I would be remiss if I did not mention her. So thank you to her and for all the BHLs who do what they do. So that's it.
Judge Cutoff, thank you so much. We appreciate each and everything you and your work group leads have done. As with Amy's group, it sounds like you guys have been extremely busy out there, and we thank you for, as all of our members, taking time out of your day to be with us. We'll now go to our last committee, and that's the Criminal Justice Committee, and their report will be provided by Judge Mayer.
All right, good afternoon, everybody. When I do my updates, my typical goal is to try to be more efficient or quicker than Judge Cutoff. But since he bucked a couple of those reports and asked you to read them, I might take a few minutes more, but we'll still try to stay on topic, okay? So first thing, you'll see our reports are in the package here. Our last meeting of the Criminal Justice Committee was at the end of August. Our work groups, like your work groups, are actively working on their work plans, looking at specific needs and goals. We still are engaging in a lot of education components in these work groups. Picking a direction is not something readily done. So taking your time and doing it well is something we've found to be valuable. And you'll see that as we kind of work through this and what some of our other work groups have done. Big key priorities have included reviewing data entry processes, and that's related to our case management system for Court of Justice, jail survey data collection, exploring juvenile competency standard in Kentucky, and then finalizing the white paper on police social workers. That is in your meeting materials. I will ask you to read it because it's about 36 pages, and no one wants to listen to me go on for 2 or 3 pages, much less 36. But please take a look at it. A lot of work went into it, a lot of thoughtful discussion and research, and I think you'll find it valuable no matter what your area of work is to spend a moment with it. We've got two work group leads who are unable to be with us today. That's Steve Shannon, and he's with pre-arrest and diversion. And that is the group that did the police white paper, the social worker white paper. So I'll direct you to look at that report, but really specifically take some time with that white paper when you have a chance. Then we also have our Juvenile Justice Committee, which is headed by Judge Jones. That has been one of the work groups that I think for the entire commission really got out early and has been doing a tremendous amount of work gathering information and putting it into practice. Specifically, you all will look and see, they're always working on legislative priorities. They're continuing to develop a mapping process for our juvenile system, talking about judicial curriculum for truancy and absenteeism. And then that big, it's a simple sentence, right? But it's a really complex idea, juvenile competency standards in Kentucky. That discussion is starting and it's not ending anytime soon. But we're happy to have those folks who've been doing all of this work leading that discussion for folks in the Commonwealth. So I will then throw it to our work group leads who are here. And first up is Dr. Slusher.
Is this on? Okay. All right. Okay, so since we last met, our work group has met twice, once in June and once in August. And so what's already been discussed so far is 202C statutes and area maybe for system improvement. So as a reminder, KCPC is the provider of individuals who are committed or petitioned under 202C. So right now about 27% of our bed space is reserved for individuals who are under a 202C order. And they have a length of stay right now of over 800 days. So we are looking to build out the system where that's appropriate, continuum of care work. So some of what I've touched on before is as we've expanded our system outside of the hospital, but under the hospital's purview, our jail-based programs. So one in Louisville Metro, we served over 70 individuals, which prevented them from going into KCPC or Central State for a misdemeanor case, KCPC for felony case. And those 70 were served in fiscal year 25. And you heard me talk about last time that we were kicking off the jail-based program in Fayette County. So we started that program on September 1st. So big thanks to Dr. Jasinski at Eastern State and Judge Tackett, who's not here today, who helped us to get all of the providers together, all the community partners to make sure everyone was really informed. We had a lot of lessons learned with the Louisville project. And so we were able to really start that, I think, on better footing. We've really pulled people together. We used orders. We were very much available to partners to answer questions ahead of time. So I think that's going to be a real system success that we feel really good about. Other areas that I've touched on before are building out the forensic healthcare system through forensic assertive community treatment. And we have a very small grant that I've mentioned with multiple partners, 3 of our community mental health centers, our Louisville jail, Central State Hospital, and clinicians, treaters at KCPC. And it's about building out evidence-based practices to serve people who are in that forensic space with behavioral health needs, but who do not necessarily need the highest level of care. So when people maybe leave KCPC, either on a pretrial 504 competency evaluation treatment order or under 202C, they have more equipped teams to make sure their needs are being met and are specifically targeting where their criminogenic risks are. So we are still in process of that. We've had a kickoff meeting. We have a technical assistance advisor, and it's really exciting, good work. And I can't wait to share everything that we learn over the course of this grant. It's very exciting. I think really groundbreaking work that Kentucky's pulling off with forensic services. So our work group has also focused on, we mentioned the clerk's manual. So the clerk's manual actually doesn't have any directions, information around the 504 competency process, criminal responsibility process too. So we're looking at how we can build in correct information, really guide courts on next steps when these cases come before them. And we talked about Casey's Law just as part of a larger systems issue. So it's not necessarily specific to our competency work group, but just when we think about behavioral health and that intersection of court orders and how people move throughout the system, we have addressed maybe some learning needs around that and some data collection. And then, of course, SES Law, I would like to share that we are still around 10 to 12 weeks for outpatient evaluations. It's actually because of an increase in orders across the state, but we are still holding strong. Our data still shows that about 60% of people who move through that outpatient process are opined as competent. We have about 10% that we're unable to determine. So those are those cases where KCPC and our other state hospitals make the recommendations for someone to come inpatient, which is that system improvement, right, where the evaluator makes that decision. So that has been working really well. And then KCPC, like I always like to share, we have a wait list of 44, so 32 of whom are in jail, 12 are on bond. So it's very exciting. Any questions for me or anything I didn't touch on? All right, appreciate y'all.
All right. Thank you, Dr. Slusher. And then we've got Erica Hargis with our reentry work group, which is our newest group.
Yes, thank you. Good afternoon. Our group has only been able to meet one time since the last time we were all together. That was July 17th. We talked about our training opportunities. We keep bringing in really dynamic speakers so that our group can continue to gather all the information that really lives in that reentry workspace. We're strengthening our connections with our partners so that we can continue to build our work plan so it can remain relevant in this space. Our work plan has gone a few directions here and there, and we're trying to tailor it. We're really waiting on the results from the jail survey. Our next meeting is this Thursday. So this Thursday, we're going to get an update on that jail survey and really dive into how our committee members can help to make sure that that is moving along and that we're getting that information. So we've kind of like tag team with the other group and kind of said, well, that's our project too. We are going to hear from Employment Reentry Services for the Kentucky Career Center. We've heard from the Department of Corrections about reentry employment services. Now we're going to hear from the Kentucky Career Center. And so we're just trying to really make sure that we are inviting in and talking to everyone that works in this space. I think Shauna is going to give us an update on the BHLs. I know all of us heard about it today, but I think we're going to make sure that our work group hears about it and the good work that they are doing so that we can also see how our work group can overlap the work they're doing and where we could maybe even help with gaps there. We have, we're really just trying to integrate some of the trainings that we have learned from and make sure that our work plan is supporting those emerging ideas. And then the survey will guide our next steps as well. One thing I wanted to share from kind of more personal with my work, I wanted to shout out Dr. Jasinski and her team. I had 2 officers take someone to empath yesterday. They had a great experience. They were able to get him back on his feet and get him back out into the community. And so I know that happens every day, but personally 2 parole officers took a guy there yesterday. So we got to tour it and see it happen, and then now we're putting it into action. So thank you all for the work you all are doing. And that is our update. Oh, and shout out to Heather, Maria, and Shauna, just like everyone else. I would be remiss without saying that because they definitely keep us going.
Any questions for our reentry work group?
Judge, I'd like to add something I forgot to say.
I'll allow it.
Thank you. When we talk about system expansion and partnering together, we have a success story that I just wanted to mention. So one of our 202C patients really could have been served through a lower level of care and was able to do so through a 208 petition through Tim's Law in Jefferson County. So big shout out to Judge Burke and her work, as well as 7 counties, because they are the provider. And so we met expansively and had lots of conversations around how individuals can actually be served in a lower level of care successfully when they are even at that highest level of commitment. So I just wanted to mention that I see that as a very large system success that really kind of touches on everything we all just reviewed. So anything you want to add? He's still doing really well. So we're very proud of that. So thanks.
Any other questions? All right. I'm a slight contrarian by nature. If you're forced to deal with me personally, you've probably realized this. So I resisted thanking Maria and Shauna and everyone else. And now my better spirits are getting me and reminding me how disappointed my parents will be if I go home and forget to thank the people who really take care of us. But I will say I did a meeting with a national group that's doing some research on reentry stuff the other day. And I mean, I don't know that this comes as a surprise to anyone here, but they were absolutely raving about Shauna. And they do call her Administrator Mitchell, which throws me for a loop. But they were absolutely raving about her and her ability to organize people and convene folks and get people who are busy and have some sort of power and authority to respond to her. If she's on your list like mine, which is just do whatever she says, right? You have that list that has 3 or 4 people on it and you just say yes to them. Well, she's one of those people on my list, and apparently for these other folks on national levels for stuff too. So we're really grateful to have her leadership. Kentucky gets to be a part of a conversation for a lot of things that I think people would guess we were on the outside of. We're not progressive enough. We're not thoughtful enough. But we are a state that cares, right? And we have people who care, like Shauna, and that's why we're in these national conversations, even if we're surprising people by being at the table. And other than that, I have to say, please talk to Heather about community mapping. We did it in Madison County. We're getting ready to do it in Clark County. It is absolutely worth your time. They've distilled the program down to a day now, so you're not doing a couple days commitment. They've taken everything they've learned in all the counties that have done it already and are putting it into practice. A day. A day is what you've got to ask for from your community leaders, from your health department, from your local hospital systems, one day, but it will benefit you tremendously, and the behavioral health liaisons help with that in an extraordinary way. It really helps them do their job better too. So please put mapping on your calendar. Get in touch with Heather. She will absolutely help you out. Thank you, Judge.
Judge Mayor, thank you so much, and your work leads. We appreciate so much the work that you're doing out there. And I do appreciate, it seems like everybody got the memo to thank Sean and her group, but I'd ask her if she did a group email to everybody there. But with that having been said, I was just in the process of texting your mother to go, your daughter did not thank them. And I know your mom, she's one of the few people who still makes me sit up straight when she walks into a courtroom.
I made her that day.
But no, thank you so much for your group, and we do appreciate it. At this time, we're going to open the floor for our agency updates. And what we try to use this roundtable approach for is if you have anything exciting that your agency's working on, or an update on something that you've had out there that you have been working on a while and you'd like to let us know of a new initiative or improvements you're making, that any other programs that's in the works out there that we may not be aware of. Long and short of it, share your success stories with us. If you'll raise your hand, we'll get a microphone around to you. There you go.
Good afternoon. My name is Christina Weeder, and I represent the Kentucky Department of Education. We shared some of this with our juvenile justice work group, but I thought it would be helpful to share a little bit more with this larger commission about the work we're doing on chronic absenteeism, which is obviously connected to truancy. But we have launched a campaign this fall that really reflects partnerships with other organizations who are members of our chronic absenteeism working group, including the Administrative Office of the Courts, the Cabinet for Health and Family Services, and educators, of course. One example of this is the data that we have from both our statewide student information system as well as the Administrative Office of the Courts data have really enabled us to target specific regions of the state, even down to the zip code with some of our campaign. And so just for a quick definition, chronic absenteeism is when students miss 90%, when they are not present 90% or more of the time. So they're missing 10% or more of their time. And because of the rich data system we have, we can calculate this down to the minute. And so this would include all time that's missed, whether it's unexcused, excused, tardies, suspensions, that sort of thing. There is a distinction there where truancy is only based on unexcused absences. And many of you are probably aware that House Bill 611 went into effect for the 24-25 school year. That requires all district directors of pupil personnel to send the names of any students who have 15 or more days of unexcused absences to their county attorneys for potential, court cases. So that could involve either a case against the family or a case against the student themselves. So we have really been looking at some of the underlying factors here and really trying to use this campaign as a call to action for not just educators, but for families and community partners. The regional interagency councils, several of them have really taken this up and tried to do some campaigns in their own communities and really address this issue. Some of the barriers that we're aware of are certainly mental health factors with both students and their families, as well as substance abuse. We're seeing more and more of that with some of the youth in our schools. May result in suspension, which could then result in being sent to court for truancy. So those are some of the things that we've been working on. Hopefully you've seen some of our campaign materials. We've got some billboards in some of the more highly populated areas, but we're also using social media and streaming ads to really target some of those specific areas in the state, as I mentioned. So we really want to continue this work with community partners to hopefully reduce the number of families that are impacted by this. Thank you.
Do we have anyone else with committee or updates you'd like to share with us or something else going on? Oh, down here at the other end. Okay, the quiet side of the room.
Thank you. Good afternoon, Katie Marks, Commissioner for our Department for Behavioral Health, Developmental and Intellectual Disabilities. I just wanted to provide a brief update following a presentation that Dr. Sussman and I gave last week. We have engaged our communities officially in the co-occurring capacity rollout that we're doing in our department. And so I just wanted to share how well this is being received by communities. This vision is really a statement that we recognize that co-occurring substance use and mental health conditions are the expectation and not the exception, right? The vast majority of people present with both, yet we have a system that's been designed, regulated, and funded as if one person shows up with one condition at a time. And so reconciling with the reality that because most people are co-occurring with their conditions, that all of the programs that we operate are therefore co-occurring programs. Whether we intend to be that way or not, that is where we have to move to as a system, is breaking down these walls between mental health services and substance use disorder services. We went to Owensboro Hazard and had one in Frankfurt. Hundreds of attendees, community partners from our hospital facilities to folks that had historically only been in the mental health space, only in the substance use space, nursing facilities, local health departments were there, and the message resonated really strongly that we are in the welcoming business. However an individual shows up, whatever their conditions are, they are welcome into our setting of help, and we will, rather than just provide a warm handoff to the next stage of their journey, we're going to provide a warm hold on. We're going to keep them close until we get them where they need to go. And so just want to continue to elevate this vision that we're going to be talking about more in depth. This is a continuous quality improvement initiative. It's not just a putting it out there in the universe that we think this is important. This is a process. One of the things that we're going to be asking everyone to do is how are we counting co-occurring individuals in our data systems? Because if we don't count them, we're not attending to the issue. So just excited to continue to update folks on how we strategically and tangibly implement this vision.
Can I ask a question?
Yes.
I'm over here, Shauna. Right. I was just going to ask how the RISE initiative specifically is going after you all presented on that last time. We've talked a lot about in our county.
It is progressing. We are still enrolling providers at this point. We've seen a significant outpouring and interest of having registered for the training. We've got over 45 providers across the state that have begun that process, but there is a drop off right now between people who have registered and begun the training and those who have submitted their application for review. At this time, we have 7 providers statewide that have made it that far along. The ability to provide services under RISE is contingent upon a provider network that is established. And so we are doing a very active outreach to folks that have started the process, that have not, that seem like they would be good community partners, but that rollout will be contingent. If there are any individuals that you think of that come to mind, that we would be happy to have one-on-one conversations with anyone. We hold standing office hours every week as well if providers have questions, but that is where we're focused right now, is that capacity.
we have anyone else that has anything you'd like to share with us at all today? I always notice the closer we get to the end of the meetings, the quieter and the sharing starts to drop off a little bit with us. But if we don't have anything, then I'll go ahead and proceed to our closing remarks. I've got to tell you, Sean always gets nervous when I'm the one that chairs these committees because she prepares these lovely, thoughtful, in-depth notes. And then I get up here and freelance on her, and it just drives her crazy. I can tell she's a nervous wreck as she sits there. It's like, stay on script, Judge, stay on script. With that having been said, as we do come to the close of today's meeting, I started off by saying thank you. And I want to again say thank you because I do appreciate how busy everyone in this room is. And I appreciate your time and your energy and your dedication to this commission and the work that we're trying to do. You know, as I look back over the last 3 years, I said, I am so pleased because I can remember our first couple meetings and the phrase that was repeated often, let's take baby steps, let's take baby steps. And I promise you, as I look back what you've accomplished in these last 3 years, I'm amazed by it. I also encourage each and every one of us that our purpose, and I don't think any of us will do it, is to rest on our laurels. I think we celebrate what we've accomplished, realize what we still have to accomplish, which is much more, and that we continue to work to do that. You know, the key to this is, I think all along has been the collaboration, creativity with the individual groups we've brought together, and the shared belief I think that each and every one of us has that we can make the system better. I think one of the biggest fallacies we fall into in any state agency is, well, that's the way it's always been and we're not going to change it. Well, yeah, we will. This group's changing it, and I truly believe of the organizations and committees I've been a member of since I've been in the judiciary, I've seen more accomplished through this group and this group of people, and I do greatly appreciate it. You know, some of you that have heard me speak before, I like to work in quotes. I'm always looking for quotes that's appropriate. And I've teased every time today somebody's bragged on Shauna or her group. I go, did you write that? Did you write that? How many of these, how many did you send out? But with that having been said, I know it's been a long day and I want to work in one of my favorite quotes, and it's from Nelson Mandela, and it says, and it's from leading behind the scenes. Nelson Mandela said, it's better to lead from behind and put others in front, especially when you celebrate victories, when nice things occur. And I want to remind Shauna, Maria, Heather, Becky, and even going up the food chain one more to Jason. And I'm pained to have to congratulate Jason in there, but I will. But long and short, every victory this commission celebrated is attributable to the time that you guys have put into it. I know Chief Justice Lambert, Deputy Chief Justice Connolly have been amazing, but I'm also smart enough to know what keeps us on track and keeps us going. And it's all of us, and it's our wonderful support group and our coworkers, and we do appreciate it. I want to remind everybody our next meeting, goodness gracious, this year is almost over. Our next meeting is December 5th here at AOC. Again, thank each and every one of you for taking the time and effort to be here with us today. We hope each and every one of you drive carefully and have a safe trip home. And with that having been said, we'll adjourn today's meeting. Thank you all so much. You did a wonderful job. I hope you